Hello students, welcome to the channel Pharma for You. So today in this video we are going to cover some questions which is very important for your Gpat exam. So here we have first question is that following intravenous administration drugs are distributed fastest to. So options are, option A is the skin, kidney and brain, and option B is the liver, kidney and brain. Option C is the liver, adipose and brain. Option C is the liver, kidney and adipose. So which is the order through the drug is distributed fastest? So the correct answer is the option B, that is the liver, kidney and brain. So the B is the correct answer. Now moving on, the second question, that which are the types of antibodies involved in hypersensitivity reactions? Options are, option A is IgG, IgD, option B is IgM or IgG and IgM, option C is IgD and IgA, option D is IgM or IgD. So which are the types of antibodies involved in hypersensitivity reaction? And the correct answer is, that is option B, IgG and IgM are involved in hypersensitivity reactions. These are the antibodies. Students, try to note down. This is the question arise in your 2015 exam. So next question is that which of the following diabetes drug act by decreasing the amount of glucose produced by the liver? So options are, option A is sulfonylurea, option B is meglitinides, option C is bigonides, option D is alpha glucosidase inhibitor. So which of the following diabetes drugs which act by decreasing the amount of glucose? So the correct answer is, that's the bigonides. Bigonides acts by decreasing the amount of glucose produced by the liver. Here we have a just simple explanation on this, that the bigonides such as metformin lower blood glucose level by reducing the amount of glucose produced by the liver, and sulfonylurea and meglitinides stimulate the beta cells of pancreas to produce more insulin. Students, try to note down the mechanism: bigonides and sulfonylureas and meglitinides. Next one is alpha glucosidase inhibitors. They block the breakdown of starch and some sugars which help to reduce blood glucose level. If the starch and some sugars breakdown stopped, then the blood glucose level is decreased. So the correct answer is bigonides. Now moving on, the next question, that when HLB value of surfactant is 10 to 11, it act best as. Options are, option A is solubilizer, option B is as O by W emulsifier, option C is W by O emulsifier, option D is detergent. So which is the correct answer? And 10 to 11. So students, remember the HLB scale. So according to the HLB scale, it represent the O by W emulsifier. Let's discuss with the help of explanation. Here it is an HLB scale. So what is the full form of HLB, students? Hydrophilic lipophilic balance is the full form. Hydrophilic and lipophilic balance, and it is discovered by Griffin, students. Griffin. If the question may ask, that it is discovered by Griffin. So according to this, it divided into three phases: hydrophobic, water dispersible and hydrophilic. So according to this, the 0 to 3 is antifoaming agent, 3 to 6 is denotes emulsifying agent, wetting agent denoted by 7 to 9, and emulsifying agent, that is 8 to 16, and 13 to 15 is detergents, and 15 to 18 is solubilizing agents. Students, just note down that it is W by O emulsifying agent. So how can you learn this? That how can you gonna learn this? That A, W and W. Students are the most of the girls are try to chat in like A. So they try to minimize or mnemonics that A for antifoaming, W for WYO emulsifying agent, and W for wetting agent. This one. So this is the starting one, 0 to 3, 3 to 6, 7 to 9. And after that, emulsifying agent, detergent, and solubilize, EDS. So you can learn like this, or EDS. EDS. These are the your increasing order of this. So students, I hope that you like the trick. So moving on the next question. Nitrates are used in ailments in option A is cerebral ischemia, option B is arrhythmia, option C is cardiac ischemia, option D is hypertension. So nitrates are used in ailments in, and the correct answer is it is used in cardiac ischemia. So students, C is the correct answer. Now we have to just have an explanation on this, that organic nitrates and inorganic nitrates which release nitric oxide are used treatment for ischemic heart disease. So it's all about this question. Moving on the next question, that identify the inhalational anesthetic agent containing bromine atom, and the options are allothane, option B is isoflurane, option C is propofol, option D is fluoxetine. So which is the inhalational anesthetic agent containing bromine atom? So the correct answer is halothane. Halothane is the inhalational anesthetic containing bromine atom. So now we have a just simple explanation on this, that halothane is the only clinically used inhalational anesthetic agent containing bromine atom. The other one are the teflurane, roflurane also contain bromine atom, but they were never marketed because of adverse effects seen during trials such as cardiac arrhythmia. Here we have just simple that it contain halothane contain bromine atom, teflurane also contain bromine atom, and it also roflurane also contain bromine atom. So these are not used in market because of their adverse effect. This is most used inhalational anesthetic which contain bromine atom. Next one question is, formation of active 125 OH in bracket 2D3 occurs in which organ? Options are skin, kidney, liver, or gut. So which is the organ where the 125 OH whole twice D3 occurs? So the correct answer is kidney. In kidney there is a formation of 125 OH in whole twice D3 occurs. So let's discuss with the help of explanation that 25 hydroxy vitamin D3 is converted into 125 dihydroxychloroe calciferolin, the proximal tubule cells of the kidney, by the action of 25 OH vitamin D3 1 alpha hydroxylase, where the 7-dehydroxycholesterol is vitamin D3 or cholecalciferol formed in skin, and vitamin D3 25 OH vitamin D3 or calciferdiol formation in liver takes place. Coming on this 25 OH vitamin D3 125 OH vitamin D3 calcitriol in kidney, the calcitriol in kidney, calciferdiol in liver, and calciferol in skin. Students, just try to note down these points. Now the next question is, the major constituent of castor oil is, and the question options are resinolic acid, option B is resinolene, option C is resinaldehydic acid, option D is all of the above. So the major constituent of castor oil is the resinolene. Let's discuss with the help of explanation, students, that the resinolene is the chief constituent, that is the 90% in the amount of castor oil is a triglyceride of resinolic acid, where the resinaldehydic acid or plus minus R resinaldehydic acid is the trans isomer of resinolic acid. So students, next question is, the process of exuding of fluid from the surface of gel is called, options are, option A is synersis, option B is hysteresis, option C is diapeditis, option D is imbibition. So the process of exuding of fluid from the surface of gel is called, and the correct answer is synersis. It's called synersis process. When we just take out the fluid from the or gel from the tube. So here we have just simple explanation on this, that what is synersis actually. Synersis is squeezing out of liquid dispersion medium from the gel matrix due to contraction of shrinkage of gels, and it is due to the excessive stretching of macromolecules and expansions of elastic force during swelling. Where the bleeding occurs, the liberation of oil or water from ointment bases resulting from a deficient gel structure rather than from the concentration as involved in synersis. And coming on the next one, that what is swelling? Swelling is increase in the volume of gel, uptake of water or other liquids. Only those liquids that solvate a gel can cause swelling. The process is influenced by temperature, pH, presence of electrolytes and other formulation ingredients. So students, this is all about this question. So the correct answer is synersis. Now the next question is, and the last question of this video is, that clopidogrel is a, and the options are P2Y12 receptor antagonist, option B is Gp second and third inhibitor, option C is vitamin K antagonist, and option D is none of the above. So clopidogrel, what is the class of clopidogrel? The correct answer is P2Y12 receptor antagonist. So let's discuss with the help of explanation that clopidogrel is a platelet aggregation inhibitor, is an antagonist of adenosine diphosphate receptor called P2Y12 present on platelet membrane. Students, this question asked in 2019 exam. Now P2Y12 receptor antagonists are the thiophenopyrimidines and nucleotide analogues and glycoproteins. So students, try to note down these classifications, because sometimes the question may also ask from the classifications also. So students, if you just like the video, please subscribe and hit the bell icon for getting more updates on our upcoming videos. Thanks for watching.